All the negotiations aside, though, I understand that you say this bill will bring a cultural shift, but what exactly does that mean? How will this bill help retain more workers in the healthcare system?
Yeah, because I think that what I want, and not only the PDG, but all the HR, the people that need to think right now, is we should focus on being the employer of choice. So when you have the choice between going on TSO, le temps supplémentaire obligatoire, or going to an agency, or spending a lot of time, because that takes a time, to negotiate with your people as to letting them doing the choice of their schedules. That's a big change of culture. Because before, what we did, take the phone an agency, and or 2 hours before the deadline on the next shift, go to TSO. We shouldn't think that way anymore. We should, and again, I'll give you an example. This new PDG that we have, Centre de Quebec, has planned the summer vacation in January. And she said, oh, I'm missing 2,000 shifts right now. So I have the choice. I warn you right away that we'll have TSO or use agency, or we apply the convention and we put this time to all employees as opposed to 75% of employees. And I think there is really a value here to change our condition in the convention. And that's a good example.
I also want to touch on the order in which you're applying this. So in terms of you're going, it'll vary region to region,
Yep.
as you mentioned. What are the criteria you're looking at in terms of where this applies first?
Well, the first criteria is availability. Like, for example, in Montreal, I think we can, because there is a change of culture also of not working in silo anymore. And this is part also of making sure that employees have more mobility. We saw that during the pandemic, that we could move employees, and so they're not limited to their region. I think that's important that we have that in mind. So, but I think it's possible in Montreal that we get rid of this way of dealing with the agency more than it's probably will be more difficult on the North Coast, for example, in Sept-Îles or in Mingan. So that's the reason. I think it's more solvable in Montreal first than it will be in the region later.
When it comes to, just the bill itself, and there's been nurses who have come out and said there's no way they're going to go back. What makes you think that, you can say this, but you're the government and you're the ones who are enacting the change of the conditions? What makes you think that just a slap on the wrist at these agencies, if they're not applying, what do you think will actually cause them to be used less and less in order for?
I would say that in French, I want to give them the goût de revenir, the desire to be back. And the desire to be back, it means they need to have good condition. They left because they didn't like the environment, okay? They didn't have the choice of their schedule. This is my job to be the employer of choice. And I think that if we can do that, but it's not going to be done like that. So, voilà. How? But that's exactly what I've explained. We have a lot of things that we are doing right now. Just take what we've done. Give you an example. What we've done with the infirmières spécialisées. How do we say the IPS? Specialized nurses? Nurse practitioner, thank you. We said they're not being used at their full value, okay? So we said, why don't you open yourself a clinic? And somebody said that's impossible in that time. We opened 7 in the last 2 months. 7. And why we've done that? Because we say we will hire you at the level of your competency and experience. But we can do that everywhere. We can do that with the auxiliary nurses. We can do that with a lot of profession. And one of the reasons they left is because they were not used at their full competency. So it's for us. This is our responsibility to do that. So this is what we'll do.
we've been seeing poll data of the workers that are being hired by private agencies, that are going through hired agencies. They like their hours, they like their vacation pay, they have limited overtime, they have better working conditions going through these agencies. Now, you seem to be twinning this process to the public sector negotiations so that working conditions improve enough to woo them back. That's your strategy. Isn't that kind of a big if? I mean, that you don't know how the negotiations are going to end. You don't know whether the working conditions in the public sector will be improved. So isn't it kind of a risky, isn't it kind of a big if on making this all happen at the same time?
Well, I just want to put the number of employees in perspective to answer your question. We need 125,000 employees over the next 5 years. If we have the same rate of departure as we have right now, because we have a portion of those 30,000 people that leave the system per year, 10,000 of them are for, what's my word? Les retraites, no retirement. But the other 20,000 is because we have a lot of people that leave the system. Those are the people that I want. So put that in perspective, we have 2,500 people in the agencies. So it's not, I'm not looking at the agencies as being the solution to my 125,000 problem. My problem is more on the retention of those that are in the system. We have been improving the number of employees in the last year about by 13,000, which is good. So at least it's not coming down anymore. It's improving a little bit, but we need some more. So my point is that when you say, is it a big if? It's not, I'm not only after the agencies. I'm after having a good retention program. And that is part of the solution that Sonia Lebel will be helping us, because those are the conditions that will make people want to stay or to come back to the system.
But if the use of these private agencies has become so commonplace to your government, and you know there's major shortages of labor in the healthcare system, it works. It's helping you, is it not? To have
No.
these, tell me why it is not helping you.
Well, first of all, it's costing a lot. You've seen the cost of that. That doesn't make sense that we pay or they pay a nurse at a certain price, and sometimes they double or they triple the price they're charging to the system. So that, in sense, that doesn't make sense. We should be paying that nurse ourselves. Now, the issue is, can we give the condition, the work condition, to that nurse that she have in the private? The challenge is always the same, is for a nurse that will do 2-3 days a week because she wants to be part-time, that she doesn't want to work the weekend, she doesn't want to work at night. Those are certain conditions that the agency can offer. And that's the reason we need also to adapt ourselves, and that's what I explained earlier, that I'm asking Madame Lebel, can we have differentiate condition for those employees that will work on unfavorable hours, like nights and weekend? So that's the reason we have this discussion with this project and the negotiation for the next convention.